All right, so interesting. So in the past, I've done quite a bit of research about Islamic fashion, so it's really interesting to see the references to those face coverings. But for the last year, I've been doing some new research about the history of service industry uniforms in the United States. Unlike manufacturing, where workers produce tangible goods for markets with little face-to-face interaction, workers in the service industries interact heavily with the public in a wide variety of roles. These include, but are not limited to, nurses and doctors, waitresses, bank tellers, gas station attendants, receptionists, hairstylists, and flight attendants. Although some of these workers, like doctors, are middle to upper class, a majority of these jobs are poorly paid and dominated by women and people of color. Many of the service industries have distinctive uniforms. In this yard sign, designed by graphic artist Rachel Verone, celebrating the essential worker heroes of Bloomington, Indiana, we see from left to right a nurse wearing scrubs and a stethoscope, a doctor wearing a lab coat, a grocer wearing an apron and a name tag, a delivery driver wearing a polo shirt and a trucker's cap, and a police officer wearing a blue button-down shirt, a military-style cap, and a high-visibility vest. Although these styles have changed over time, one of the enduring functions of occupational uniforms is to make the role of the person who wears it easy for the general public to recognize. In this brief presentation, I'm focusing on food service workers, which is just one category of service industry employees. Although I will highlight some of the unique dimensions of this particular industry, it is important to recognize that there are commonalities with the other service industries. Turnover is high, so workers often experience different workplaces and different categories of jobs. For example, a bank teller might work as a bartender at night. There's also overlap because of the companies that make uniforms. Compared to fashion retailing, uniform manufacturing is a fairly stable industry. Many companies have been in business for decades and make uniforms for different categories of workers. For instance, Barco, a company founded in 1929 in Los Angeles to produce uniforms for hairstylists and domestic servants, is still operating today. It supplies uniforms to medical workers and major fast food chains, including Sonic, Domino's, P.F. Chang's, and Panda Express. Minor changes in the design of a uniform can often make it usable for different industries. So for example, a polo shirt might be worn by a delivery driver, a fast food worker, or a private security agent. In 2018, the average income for an individual worker in the US was $50,000. In contrast, the average income for a food service worker with a full-time job, which is not even available for many workers in the industry, was only $32,000. Workers who get tips from their customers, such as bartenders and waitresses, can legally be paid as little as $2.13 per hour. Although employers are required to ensure that employees receive at least the federal minimum wage, which is $7.25 per hour, enforcement is minimal. In a study of 9,000 restaurants operating in the US, the Department of Labor found that 84% were violating minimum wage laws. Because of these low wages and the lack of universal health care in the United States, most of the 12 million people who work in the food service industry cannot afford to take a sick day or go to the doctor even during the current pandemic. When the first cases of COVID-19 began showing up in the US, the Centers for Disease Control issued a statement that people in the general public should not wear masks because they were ineffective and more desperately needed by healthcare workers. In a tweet on February 29th, the US Surgeon General urged, "Seriously, people, stop buying masks. They are not effective in preventing the general public from catching coronavirus, but if healthcare workers can't get them to care for sick patients, it puts them and our communities at risk." When the World Health Organization declared a global pandemic and many states decided to close schools and businesses, they designated certain categories of people who would be allowed or even needed to continue working. In the state of Indiana, for example, which is where I live, the list of essential industries was long, including healthcare, childcare, grocery stores, gas stations, laundromats, banks, delivery services, transportation services, gun stores, and hotels. Although restaurants had to close for dine-in service, many quickly set up carry-out and delivery options. On April 3rd, the Centers for Disease Control reversed its position, issuing new guidelines that all Americans should wear, quote, cloth face coverings in public settings where other social distancing measures are difficult to maintain. The US Surgeon General even released a 45-second YouTube video demonstrating how to make a simple mask at home. However, at a news conference later that day, President Trump contradicted the guidelines, emphasizing that wearing a mask was voluntary and said, quote unquote, "I don't think I'm going to be doing it." Under the General Duty Clause established in 1970 by the US Occupational Health and Safety Administration, better known as OSHA, employers must provide, quote, a place of employment which is free from recognized hazards that are causing or are likely to cause death or serious physical harm to employees, unquote. COVID-19, which is clearly a risk for serious illness and or death, is putting this OSHA clause to an unprecedented test. It appears that many employers have been paying close attention to the CDC. On March 20th, for example, an article published in the New York Times noted that, quote, Walmart, which employs 1.5 million people in the United States, is not providing masks and gloves in its stores because a company spokesman said it was following guidelines from the CDC, which do not explicitly recommend them for workers outside the medical profession. On March 31st, Walmart's president and CEO issued a press release with a revised policy, which is now on the company's website. Quote, while the CDC and other health officials do not recommend masks or gloves for healthy people who don't ordinarily use them for their jobs, we will make them available, as supplies permit, for associates who want to wear them. The masks will arrive in 1 to 2 weeks. They will be high-quality masks, but not N95 respirators, unquote. And then again, a few days after the CDC reversed its position, Walmart updated its policy to say, we are now making face masks mandatory in many communities where we are seeing elevated cases, as we recently did in the New Orleans area. So lots of changes. Although wearing a mask is a health issue, it is also an item of dress that can be regulated by an employer's dress code. So Starbucks, for example, which now requires all employees to wear a mask at work, has a 15-page dress code specifying colors and types of clothing, jewelry, footwear, hairstyles, tattoos, and personal hygiene. Personal clothing is allowed, but must be worn with a clean and wrinkle-free uniform apron. Although the basic shape is the same as aprons worn by grocery store and fast food workers, the iconic green color and Starbucks logo extends the company's brand to the bodies of its employees. Not all employers have been swayed by the advice of the CDC. In the same March 20th article in the New York Times, representatives for Stop and Shop, a chain of over 400 grocery stores based in Massachusetts, argued that employees should not wear masks since they, quote, send the wrong message to already jittery shoppers that the worker is ill, unquote. A representative for the workers' union even agreed, speculating that masks would heighten fears, which would make it more challenging for the workers to deal with customers. Regardless of whether food service employees are allowed to wear masks or not, the risk that they might continue to work while sick is very real. People of color, particularly African Americans, Latinx, and Native Americans, have been some of the hardest hit by COVID-19, but are also more likely than whites to be employed in the food service industry. The issue of wearing a mask has also become highly politicized, as many people have noted. Before the pandemic, masks were associated with personal illness. This has a moral connotation in a country where there is no universal healthcare system and individuals are expected to, quote unquote, take care of themselves. As a particular item of dress, face coverings have also long been associated with outlaws, gang members, ultra-conservative Muslims, and radical protesters, groups that many people have viewed as, quote unquote, bad guys who should not be emulated. During the pandemic, covering the face has taken on new connotations. People wearing masks have been mocked for being afraid of a virus, for being too willing to give up their personal freedoms, excuse me, and like Russia, particularly in areas where rates of infection have been low, for being duped by what some see as a conspiracy or a hoax. Some people wearing masks have even been physically attacked. A security guard in Michigan was murdered for asking a customer to follow the store's policy on wearing masks. Obviously, this underlying history makes decision by employers about whether or not to allow or even require masks more difficult. In the Bloomington Heroes yard sign, the graphic artist originally depicted the grocery store worker in the center without a mask because she wanted one of the workers to be shown smiling. She changed the graphic at the request of the organization that commissioned it and wrote to me in an email, quote, "It was the right call now that we really all should be wearing masks to do our part," unquote. Obviously, this is a complicated issue and one that I think is likely to evolve significantly over the coming months. That's it.
Heather, thank you so much. Comments, questions?
There we go.
Okay, yes, Agata, please.
Button, okay. Hi. I have one actually remark. I very much liked your presentation. I think it touched on a subject of this visibility of people, like on the roles that we kind of distinguish people on basically in their function in the society. I just wanted to add one thing that that was sparkled by your picture of the Starbucks apron and the employees which actually wear the corporate branding on their bodies. I was actually also looking at one other professional group, which was the whole aviation industry, which was very, very much hit by the pandemic. And I thought that basically this group is so very much defined by their uniforms. I mean, in any kind of spaces like an airport, I mean, you immediately see which is Emirates, which is, I don't know, Cathay Pacific, which is British Airways. It's kind of an instant, branding. You're like a branding billboard, basically. And just a comment that I felt so sorry for all these stewardesses that kind of lose this identity, which is so very, based on their uniform. It's kind of a part of who they are on a daily basis. But thank you very much for touching it on the less glamorous, let's say, and less visible professional groups. Thank you.
Yeah, thank you. I definitely think this is one area where the situation will evolve with employers, because definitely some are starting to go now to developing uniform masks. So at first, when workers started requesting them, they weren't part of the uniform, so nobody really knew what to do. And sometimes they were able to acquire enough that they could give everyone exactly the same style or same color. And maybe that will be the trend. Like I've started to see, I saw someone at Kroger grocery store wearing a blue Kroger mask with the Kroger logo on it. So that could become something that happens, but hasn't really had a chance to happen yet, just because people are still scrambling.
Thank you. Questions, comments? Okay.
I see the comment about the black masks, and that was definitely something I picked up in your presentation, Allison. I was interested in that connotation.
Yes, and there was also a comment earlier from Yana Milkumova-Reynolds about how, interestingly, yes, in the UK, they do have this class division of mask wearing and non-wearing. And key workers and frontline workers are the one who do wear masks. So yeah, just right. Okay, so thank you so much, Heather, for your fantastic presentation.